Before we dive into cardiology, I'd like to understand who you are as a person beyond the hospital.
So beyond the hospital, I would be spending some time with my family, updating myself about my field of interest, which is cardiology, the things that I do. But in reality, no doctor is completely off. In fact,
true.
no cardiologist is completely off when he goes out of a hospital. I wanted to become a cardiologist because the most complex machine in human body is heart.
Heart.
So I wanted to repair heart. Heart health needs discipline and it needs effort, and we need to keep blood pressure under control, we need to keep diabetes under control, we need to keep the bad cholesterol under check, stress levels under check. You are diagnosed with heart disease, then we will control our high blood pressure, we will control our diabetes, we will control our cholesterol. That should not be the case.
Most underrated health habit.
Exercise and meditation.
Welcome back to Beyond the Title, a podcast where we go beyond the achievements and titles into the stories and experiences of people that truly define them. On today's episode of Beyond the Title, we're talking about something that connects all of us, our heart. Joined by us today is Senior Consultant Cardiologist and Director Interventional Cardiology in Care Hospitals Banjara Hills, Dr. Narasa Raju Kavalipati. Hello sir, welcome to Beyond the Title. Thank you for making time to join us today. So before we dive into cardiology, I'd like to understand who you are as a person beyond the hospital.
Thank you for inviting me to your podcast.
Thank you.
So beyond the hospital, I am a regular, normal person. I would love to be a normal person. I would love to spend some quality time with my family.
Right.
And of course, as a doctor, I would like to update myself about the current happenings in my field of interest, which is cardiology. So beyond the hospital, I would be spending some time with my family, updating myself about my field of interest, which is cardiology, and I would be also taking out some time for my personal health.
Right.
This is essential for everyone.
True.
So these are the things that I do. But in reality, most of the times, no doctor is completely off. In fact, no cardiologist is completely off when he goes out of a hospital.
Right.
So when I reach home, still there are sometimes, or in fact every day, I keep monitoring remotely my patients through my team. My junior colleagues will be updating me about the inpatients, their progress and how they are doing. And once in a while, if my physical presence is required, at odd times I may have to visit a hospital.
The hospital.
This is of course the life of any average cardiologist.
Right. Did you always know that you were going to get into medicine?
Honestly, no. As a child, in fact, I was like all children are. I was very curious about how things work, especially machines, how machines work. And people who repair machines used to be, the way they repair it used to be like
fascinating.
a very fascinating thing. And when I went into school and beyond, probably at that time I wanted to become an engineer. I don't know. I don't remember.
Okay.
But when I went into school and in the mid-school, I found biology very interesting. And the reason why it interested me more was twofold. One, biology deals with, especially the human biology deals with the complex machine that God created. That is the human body. And the other reason is, you may laugh at me, it's the fear of mathematics.
Oh yeah, of course.
So I was more interested in biology, and that's how that human biology and people who repair the problems of the human body or the human machine, you can call the body machine, are doctors. So I wanted to become a doctor in childhood itself, in the late school itself. That's how I
got into medicine.
Got into biology and into medicine.
Beautifully put. So why cardiology?
Yeah, when I joined my medicine, so in the MBBS days, early on I wanted to become a surgeon because that's what it appeared like, the people who repair, in fact, they repair the machine,
Machines,
human
right.
body, the machine
Right.
surgeons. So, but as I went ahead in MBBS,
Right.
I found that internal medicine, which deals with, heart, that is the early 90s. Early
Right.
90s, there is a lot of revolution, or you can say a lot of research happening in cardiology. So that's the time, in fact, worldwide the cardiology picked up.
Right.
So in that time, at that time, I found cardiology is more interesting, and I wanted to become a cardiologist because the most complex machine in human body is heart.
Heart.
So I wanted to
Right.
repair heart.
Wow. So, what is the part of being a cardiologist that not many people know about?
What I can say, suppose if I have to answer it from the perspective of a cardiologist, how a
Right.
cardiologist becomes a cardiologist.
Mm-hmm.
This requires more than a decade of dedication,
Right.
hard work, and some sacrifices.
Mm.
It is not only the individual, but the family. The family
Right.
also is making some sacrifices that probably many lay people may not be aware of. Many
Right.
people may be aware that a doctor becomes a doctor, or a super specialist becomes a super
Exactly.
specialist by virtue of his dedication, by virtue of his, putting long hours and
Right.
sacrificing sleep, sometimes meals. See, sometimes a
Personal life,
doctor,
majority
yeah,
of your
many
personal
times,
life.
yeah,
Yeah.
doctor has to spend lot of lot of
Right.
hours, sometimes without a meal. A cup of coffee becomes the meal for the day,
True.
sometimes. And sleeping only 2 to 3 hours, and sleeping on examination couches sometimes. That's
True.
the journey of a doctor to
Right.
become a super specialist in general. But many people are probably aware of this, but they don't realize the sacrifices that the family makes. So that's
Hmm.
probably, I mean, if you ask me, I don't know what lay people
Right.
don't know about a
But
doctor, but I
right.
feel that's probably what is not realized by the lay people.
So, what do you think are the biggest misconceptions that people have about health today?
So the misconceptions about health, in particular about heart health,
Right.
many people assume that having no risk factors is equivalent to having no heart disease.
Okay.
So, like for example, we often see in practice people arguing with us, like I have normal cholesterol, I don't take a fatty meal, I don't have high blood pressure, I cannot have heart disease.
Right.
But it's not true. It's a misconception. Without having a high cholesterol, without taking a fatty meal, also somebody can have a blockage of a blood vessel
Right.
of the heart and hence develop a heart disease. So
Okay.
again, some of the misconceptions are many times the general notion is that after a meal, if there is a burning in the chest,
Right.
or if there is some heaviness in the chest, it's related to the meal, but it could be a sign of a heart attack. So
Okay.
many times what is thought of by the people or the general public as a gas or an acidity may be a sign of an impending heart attack. So that's
Oh.
very important, and people should be aware that especially in the middle age, and if some symptom like this develops, any heaviness in the chest or some burning in the chest, that may be a sign of a heart disease.
Does it have to be a recurring thing for it to be considered as a sign for a heart disease?
Yeah, see, this recurring thing is going to make the diagnosis of heart disease more likely.
Okay.
But the first episode may be a sign of a heart attack.
Okay.
So when somebody has this sort of an experience, especially which is unprovoked, and what is appearing like a gas or a heaviness or a burning in the mid chest
Right.
or in the upper epigastrium, especially if it goes to the lower jaw and left arm, that should make somebody suspect having a
A
heart
heart
problem.
problem. Okay. Okay. How much of a role does stress and anxiety play in the heart health?
See, if you ask me, nowadays the predominant role is by stress and lack of sleep, sedentary lifestyle. These are
Right.
the prime drivers of heart disease. So that's why we see in young people,
Right.
apparently healthy. Suppose somebody is in the 20s, 30s, you must have heard of people developing heart
Right.
problems at such an age. This is because of stress, sedentary lifestyle, and poor lifestyle, like indulging in smoking and having a very heart unhealthy diet, like
Right.
diet which very rich in saturated fat, and a diet which is rich in calories, and coupled with lack of sleep.
Okay.
That is the driver for development of heart disease in young people.
If somebody wanted to improve their heart health today, what are the major habits that they should inculcate in their routine?
The best one is exercise.
Okay.
So, regular exercise, moderate intensity. It should not be very intense.
Okay.
Moderate intensity activity, preferably aerobic, a
Okay.
combination of aerobic and resistance exercise. The aerobic exercise, which is maintained for at least 30 minutes a day, so we say 150 minutes a week.
Okay.
150 minutes a week, which means 5 days a week, 5 into 30, 150 minutes.
Right.
150 minutes of activity per week. That's
Okay.
the best advice. And the other thing that one has to maintain is a diet, a heart
Right.
healthy diet, a diet which is rich in fruits and vegetables, low in saturated fat, low in carbs, not zero carbs, but
Okay.
especially the the sugary things, the
Right.
sweetened beverages and
Oily foods.
all oily foods, deep fried items.
And
All
fried
these have
items.
to be avoided.
Okay.
That's the best way. Exercise and
Diet.
maintain a
Balanced
diet,
diet.
and once in a while to get health checkups
Right.
to see that high blood pressure, diabetes, and
Right.
then things like that, to be screened for cholesterol. So
Okay.
everyone should have a cholesterol screened, and if cholesterol is high, especially the bad cholesterol, that needs intervention based on the level of cholesterol.
Okay.
That's the way to keep heart healthy.
What are the major tests that one should get done post the age of 40 years, let's say,
So,
regularly?
yeah, so one is screening for hypertension.
Okay.
The way to screen for hypertension is by measuring blood pressure.
Right.
And then screening for diabetes. So blood tests like fasting, postprandial blood sugar, and HbA1c.
Right.
These give us an idea about the diabetic status. Then evaluation for cholesterol. A test called fasting lipid profile gives
Right.
us the the lipid parameters, the good cholesterol, the bad cholesterol. This is one test. And an ECG and an electrocardiogram, which is ECG is nothing but an
Right.
electrocardiogram, and an echocardiogram, which gives us an idea about heart's pumping ability.
Okay.
And in selected cases where there are doubtful symptoms, a stress test called a treadmill test.
Okay.
So these are some of the tests that would be required for when we are trying to assess for heart disease.
Are there possibilities where all of these tests come normal, but still the person has an underlying issue?
Yes, it's quite possible.
Okay.
So in fact, none of the tests that we do have
Right.
100% accuracy in predicting heart disease.
Right.
So that's why all these tests have to be correlated clinically. So look at the individual, whether there's a family history of heart disease, whether the individual has a lot of stress in his life,
Right.
lifestyle, and sedentary lifestyle. So some of them are drivers to having heart disease in spite of the tests being normal.
Normal.
So
Right.
this assessment has to be made by a cardiologist. It's not that the individual will get the test done
Right.
and look at the tests and say all the tests are normal, so I am free of heart disease. Nobody can diagnose the heart disease or rule out a heart disease by themselves.
Right. So these days, whenever we go to a doctor, any kind of doctor, the first question they ask is, how's your food intake and how many hours of sleep you get per day? So how important are these, especially sleep? We have a lot of issues coming up because of irregular sleep cycles and consistently getting only 4 to 5 hours of sleep every day. So what is the effect of sleep cycle on heart health?
So sleep is a very important restorer of heart health, or in general body's health. So during sleep, there are certain physiological changes which happen in the body, and which are like reparative processes. So for a good reparative process to go on with sleep, the sleep should be at least 6 to 7 hours. And during sleep, normally all of us, during the sleep, we have a 10 to 15% or 10 to 20% dip in the blood pressure. Heart rate, blood pressure dips. This is called nocturnal dipping. This is a very important phenomenon where heart really gets rest. So suppose you are depriving somebody of the sleep, this dip doesn't happen. That can have a heightened activity of the heart. So it's like you have not completely restored the heart to its normalcy, and you are making it work the next day. So which is wrong. So we recommend 6 to 7 hours of good quality sleep, which restores the heart health and restores the individual. It's like the best antioxidant, means some of the processes which happen in the body are negated by sleep.
What common food habits, other than the fried food or the sugary drinks, what are these food habits that are damaging our health?
So yeah, you rightly said, the sugary things, the fried foods, and very high calorie content in the diet. So when the calorie content in the diet goes high, for whatever form, it need not be fat, it need not be sugar, it can be protein also. When the calories are high, body naturally converts that into the fat and stores, glycogen and fat and stores. So this tends to raise the cholesterol levels. The triglycerides go up, and consequently the HDL, the good cholesterol, comes down. And so the calorie, apart from the quality of food, where you are talking about the sugary things and the fatty things, it is also the calories which is important when it comes to heart health.
Heart health, right. At what age should people actually start getting these regular health checkups?
See, beyond the age of 18, first test should be done. A screening for cholesterol should be done as early as 18 years. And if it's normal, fine. Once in a while, some screening for blood pressure, diabetes, because we often see diabetes manifesting very early on, maybe in the early 20s. Some people have diabetes which is unrecognized. They go into the pre-diabetic range, and over a period of time, with the sedentary lifestyle and burdening themselves with high calorie food, they land in frank diabetes. So people in the pre-diabetic stage itself, they are prone to having heart disease. So that is the time we have to pick up and do the dietary intervention, the intervention by exercise, and try to keep the pre-diabetic state to almost like normalcy.
Are these heart diseases, are they hereditary? Do they pass on?
Yes, this heart disease, especially the coronary artery disease, where the blocks form in the coronaries, which are the blood vessels supplying heart muscle with blood. The blocks which form in the coronary arteries are genetic. So there is a genetic component. Suppose somebody in the family, a first degree relative. By a first degree relative, we mean brother, sister, father, mother, or son, daughter. Any of them have a heart disease, especially a block. The other family members are also having a risk of having heart disease, especially if this develops at a young age.
What is the biggest heart health related myth that's circulating on social media these days?
Yeah, social media has a lot of myths. See, if you ask me, I feel the biggest myth is the so-called detox foods, or the magic food hack which would cure you of heart disease. Such a thing doesn't exist. So heart health needs discipline, and it needs effort, and we need to keep blood pressure under control, we need to keep diabetes under control, we need to keep the bad cholesterol under check, stress levels under check. That is the way to prevent heart disease or prevent progression of heart disease. It's not that you consume some magic potion and then suddenly the heart disease disappears. Such a thing that's the biggest, I feel,
misconception,
misconception or myth which is circulating in social media.
How useful or how accurate do you think these smartwatches or trackers are?
So these are very good. They give us an idea about the heart rate, and also the irregularities of the heart rate are picked up. Nowadays, the artificial intelligence is also going into this, and sometimes it aids the doctor in picking up some of the rhythm problems and heart related problems, heart rate related problems are
Right.
being detected by this.
Right. In your years of experience, have you come across a case where you were like very shocked by the condition of the patient, or a story that kind of stayed with you for really long?
Yeah, lot of patient stories which we. So maybe a decade ago, I saw one middle-aged gentleman who was in his early 50s,
Right.
who came with a very bad heart attack, who came in a very near collapse state. Okay, so he came with what is known as a cardiogenic shock, where the blood pressure is very low, heart rate beats very fast, and this heart pumping being very weak following a massive heart attack.
Right.
This is a condition where the mortality, means the death rates, are close to 50 to 60%.
Okay.
So this gentleman, we did an emergency intervention and had a very stormy course in hospital, stayed in hospital for a long time with lot of supports, ventilation and supports to pick up blood pressure, and
Right.
he survived. It is common,
Right.
common that with sometimes with our efforts they survive, but the important thing that I realized recently when he came for a visit, he is now hale and healthy
Right.
post a decade, and he's become an advocate of healthy heart to
Oh,
his
wow.
community, his friends. So he was, to begin with, before the story started with us, he was a very highly dynamic kind of an executive, where he was working very hard, working out of the out of his office hours,
Right.
and he was a dynamic person. He was
Okay.
very kind of a what we call type A personality.
Okay.
So he never cared about getting a
Health.
health checkup done, or never cared about his own personal health. So he was running after his profession. So
Right.
it's good. It's good to be very professional and to be very good with your profession. It's good, but
But
at the same time,
time,
now he realized that
importance
being
of
like
health.
that, he neglected his own health. So he's
Right.
telling all his colleagues, he must have brought close to, over the last 10 years or so, he must have brought more than 100 people to me
Wow.
to get their heart health checked, to prevent an event. So this is what highlights an important aspect in practice, where we need to focus on prevention. So many times what happens, after the development of a disease, somebody is talking about prevention. Means
Right.
you are diagnosed with heart disease, then we will control our high blood pressure, we will control our diabetes, we will control our cholesterol. That should not be the case. Now this this case actually, I mean, it's very heartening
Personal
for
to
me
you.
also, because this gentleman, he is involved in protecting a lot of his friends and colleagues,
Right.
and that's the way it should be. And
Yeah.
that's this story lingers with me all the time in my
Right.
mind.
So, if you suspect someone around you is having a heart attack or some form of episode related to heart health, what are the things, immediate things that you should do, and what things you shouldn't do?
So somebody is known to be or suspected to have heart problem. The best thing that can be done is giving a soluble aspirin. So
Okay.
aspirin, put it in a glass of water, soluble aspirin, and make him drink. So this is a blood thinner. So heart attack happens because of a clot formation in a blood vessel. So
Okay.
this blood thinner helps in, you know, uh, the further progression of the clot in the heart's blood vessel and limits the damage. And the second important thing is, we should reassure the person
That
that
everything's
don't panic.
Right.
So no panic. Panic doesn't serve any purpose. In fact, when we are the things that are done by people are like getting frightened and make the individual also get frightened.
Right.
Third thing is, make him completely make him at rest. Don't make him exert at all. Try to mobilize him from the place where he is having the heart attack to a nearest hospital, and with minimal exertion by him. Don't make him walk. Sometimes some people with a heart attack also, with an ongoing heart attack, they say, no, we are okay, we will walk and go. Don't let them do it. So they should be treated very separately. They, if at all possible, a wheelchair, or carry him in an ambulance to a nearest hospital. So the maximum rest that we give to the heart muscle, the more rest we give to the heart muscle, the more heart muscle gets saved, because it is dying of lack of nutrition, oxygen. Suppose we make the individual walk or do activities, then that is putting more strain on the heart.
In cases of panic attacks or anxiety or a very enormous amount of stress, we often feel a pain in chest, or some people assume it to be a heart related pain and all. So how much of it is actually in our head, or it's actually happening in the heart? What's the reason behind heart pain or chest pain?
So when somebody is having a panic attack or an acute anxiety, this can manifest in variety of symptoms. It can be a headache, it can be a heart attack like pain, or it can be nausea, it can be sweatings. Variety of symptoms can manifest as a or palpitations, very rapid heart beating sound. So variety of symptoms can be there. So the best way to see whether it is a panic attack or an anxiety, acute anxiety or a heart attack, is by evaluation. So by taking an ECG and doing a heart scan, which is called echocardiogram, and a blood test called troponin, which would rule out a heart problem. So this has to be done by a qualified medical professional. It can't be, people should not assume that it is a panic attack. The individual who is having this may be having a real heart attack also, because when somebody develops a heart attack also, all these symptoms can develop: palpitations, pain, and sweatings, and fear, impending, a sense of an impending doom. All these can develop in a person who is having a heart attack also. So best thing is they go to an emergency room. See, nowadays all the hospitals have a 24/7 emergency, and get a ECG done, test done, and get an evaluation by a cardiologist.
What kind of health devices should we all actually have at our houses? Like very handy ones.
So the simplest one is having a blood pressure apparatus. So it is that's very handy and useful, because you can check the heart rate and blood pressure. And other thing is a glucometer. A glucometer, which especially this is helpful for a diabetic. So suppose there are symptoms of extreme weakness, there may be hypoglycemia. What we call as hypoglycemia is dangerously low sugar levels in the body. That can be picked up by a simple test, a prick and a pinprick, and then we can know the sugar values. Other useful instrument may be an oximeter, pulse oximeter, which would give us the saturations. So all of them serve different purposes. So glucometer would give us an idea about the sugar levels, and BP apparatus would give us about the blood pressure and heart rate. Oximeter would give us an idea about saturations, especially during the COVID times. Everybody became aware of a pulse oximeter.
True. What actually causes a blockage in heart?
So normally, if you look at an artery has the inner lining is a very shining and non-sticky kind of a layer, which is called endothelium. It is like your non-stick pan, nothing gets stuck. It's like that, something like that. So due to variety of reasons, say it may be a high blood pressure, it may be a high level of glucose in the blood, or high level of cholesterol, or injuring agents like a smoke, a tobacco. All these can damage the inner lining. Once the inner lining is damaged, the circulating cholesterol tends to get deposited there. It tends to get stuck. So what was non-sticky to begin with now became something where things can get stuck. So once cholesterol gets stuck there or gets deposited there, a variety of reactions happen there in the wall. some immune reaction happens, some cells start coming there, they sort of try to fight with the cholesterol which is getting deposited, and then that goes on, that fight, then there's some healing, then the further worsening of the some chemicals are released locally at the place where this reaction is happening, that weakens the vessel wall and makes it prone to have further blockage or further worsening of the disease process.
We often see these days that newborn babies and even kids come up with something called a hole in the heart. Is it? What causes that, and what are the treatments?
Yeah, to put it very simply, it's a manufacturing defect. So see, if you look at how heart develops, it's a very complex process. It doesn't form just like that. It forms by the embryologically, heart forms by various things coming together, a lot of twist happens inside, and that's how the human heart develops. So if you look at all the steps, it's a wonder how a normal, how somebody can have a normal heart. It's so complex. It's a complex way the heart gets manufactured in our body. So sometimes there are some errors in the the way it is getting connected. So suppose the connections don't happen properly, there will be an area where there is no connection. That is like a defect, what we call as a hole. So that's how the unfortunate kids are born with some holes, or sometimes the main vessels are also wrongly positioned. So many things can happen. So many types of diseases which are called congenital heart diseases can develop due to the process of development of the heart itself.
How do you treat something like that? Is it curable?
Yeah, it is curable. Majority of them luckily are curable. Some of them are not. So it all depends on the kind of problem. So where the the hole is there, or what location, the extent, the size, all these things matter. So
are pregnant women more prone to heart diseases?
No, such pregnant women are not prone to having heart disease, but in pregnancy, certain people, especially people who have some disorders like connective tissue disorders and things like, they can have some heart problems developing in them, like there can be rupture of blood vessels, a tear forming in the blood vessels, or sometimes these pregnant ladies, some of them can have a weakness of the heart developing due to various reasons.
Is it psychological in any way?
It is not totally psychological. It is due to an immunological process in the body itself. So they can have a weakness of the heart, which is called peripartum cardiomyopathy. And they can have variety of problems like rhythm problems can happen. This happens luckily in minority of the people. Majority of the people, see, if we talk like this, and all the pregnant ladies, they don't have to worry that they may develop a heart disease. It happens very rarely. There is unfortunate people, they can develop some of these conditions.
Are there any precautions that can be taken beforehand
to
avoid?
So when there are symptoms, it is better to evaluate early. So the precaution, the best precaution or the best advice that we can give to a pregnant lady is, there is any unusual symptom, especially heart related symptom like palpitations or breathlessness which is out of proportion, then these ladies should get a cardiac evaluation done.
So let's talk about post-stent care. Like, what are the best practices for someone who just got a stent placed? What are the best post-operation care practices?
So when post-stenting, post-coronary angioplasty and stenting, the best thing that the patient can do is sticking to the medications as prescribed by the cardiologist. So many times what I have seen in my practice is, once in spite of the best counseling, the patients tend to skip drugs, miss drugs. Missing drugs, especially in the post-angioplasty or post-stenting period, is very dangerous, because the stent is like a metallic spring-like thing which is placed in the artery, and it has a tendency to have clot formation in it. So blood thinners are given to fight this.
Okay.
and till an endothelialization means some layer of tissue forms on the stent, blood when it is exposed to the stent, there is always a chance for clot formation.
Okay.
So stopping medicines can make the individual develop a what you call a clot in the stent, which is called acute stent thrombosis or stent thrombosis, which sometimes can be fatal.
Okay.
So that's why the best thing is sticking to the medicines, dietary advice as given, keeping all the risk factors under control, means the high blood pressure, diabetes, medications have to be taken regularly, and whenever there is any unusual symptom in the immediate post angioplasty time, and once you have reached your home but still you are having some symptoms, keep a low threshold to contact your cardiologist and go to the hospital.
Right.
And don't assume things, but because doctor is giving so many medicines, I am having some acidity like this, don't assume things, and whenever anything is abnormal, go keep a low threshold to go and see your cardiologist.
For someone hearing the word pacemaker for the first time, could you tell it in simple terms what it does?
Yeah, so normally heart has some electrical wires inside, where the upper chamber, the right upper chamber has one pacemaker which sets the rate for the entire heart.
Okay.
So due to various reasons, it can be in the upper chamber or the junction between the upper chambers and the lower chambers, there can be a disconnection, means there is no electrical activity which is going on, and the entire heart is the upper chambers are beating on their own, the lower chambers are beating on their own. This is a situation which is called complete heart block, where the upper chambers are disconnected electrically from the lower chambers.
Right.
So the lower chambers have a rate which is low, upper chambers have a rate which is high. So they will be beating at different rates.
Right.
So because of this, and also because the heart rate, the lower chambers are the ones which pump blood into the circulation.
Right.
The left side one, the left ventricle pumps blood into the systemic circulation, right side one pumps blood into the pulmonary circulation, the lungs.
Right.
So once the rate goes down in these chambers, so naturally the output comes down, the cardiac output. So for somebody to exercise or to walk or to stay awake, you need blood going into the various organs, especially the brain. So these individuals, because the blood pressure, the output is low, because of a low rate, they develop symptoms like low output symptoms, what we call giddiness, they feel breathless, and they can fall. When they walk, they can have a fall and injure themselves. Sometimes it can lead to a cardiac arrest also. So to treat this, we put a pacemaker. Pacemaker is nothing but a pulse generator which has got two wires, and the one wire will be in the upper chamber, the lower one, the other wire will be in the lower chamber, and then we sync both of them. So the pulse generator is smart enough to sync, and then this leads to a very coordinated, synchronous activity between the upper and the lower chambers, keeps the output and the heart rate under control.
So we often get confused between the terms cardiac arrest and a heart attack. So how can you differentiate between either of these? Are they the same?
Yeah, cardiac arrest and heart attack are not the same.
Okay.
Cardiac arrest is a specific term which means that there is an electrical activity cessation. Somebody can have a heart attack without cardiac arrest,
Okay.
or a cardiac arrest without a heart attack, because they are talking about two different things.
Right.
Cardiac arrest is, we know about the electrical activation of the heart. So cardiac arrest is a specific term where we have a complete cessation of the electrical activation of the heart. So there is no electrical activity.
Right.
So heart muscle is not injured. It can be associated with a heart attack, but not all heart attacks are cardiac arrests.
Okay.
You understand?
So cardiac arrest is more fatal?
More fatal. So cardiac arrest is where there is a complete cessation of your heart's activity, where there is no output coming from the heart. It's a potentially life-threatening situation. Unless we act immediately or we resuscitate the individual is going to succumb to it. Whereas heart attack is a specific term where there is a blood supply cut off to the heart muscle.
Right.
So heart muscle is dying of lack of oxygen and nutrients.
Right.
So this heart muscle is going into a state of death. But this individual is able to pump
Right.
blood, and the individual is experiencing lot of symptoms like pain, low BP, giddiness, so many things.
Right.
But still the heart is still active.
So there won't be any warning signs for cardiac arrest?
See, cardiac arrest happens due to various reasons. One of them is again heart attack. So sometimes this, so when it happens because of a heart attack,
Right.
cardiac arrest happens because of a heart attack, then there is a warning signs of heart attack.
Right.
Sometimes cardiac arrest happens without heart attack, in which case this can have some premonitory symptoms like giddiness, some sweatings, palpitations where the heart beats very fast. So some of these symptoms can be there prior to a cardiac arrest.
The hand pull or something, is that?
Left arm pain, left arm dragging pain, that is
Right.
a more of a sign of a heart attack,
Heart attack.
not cardiac arrest.
Okay. So what's the very immediate thing that one should do when suspect a cardiac arrest?
So somebody has a cardiac arrest where there is no output, you should, the basic CPR has to be done.
Okay.
So cardiopulmonary resuscitation, that is, you must have heard of the cardiac massage, the direct cardiac massage,
Right.
and the mouth-to-mouth breathing. So
Right.
these are the things which would maintain the respiration and the output. So somebody is effectively giving a massage on the chest, that maintains the blood flow, and the blood flow is maintained to vital organs like brain. So of all the organs, brain is very sensitive. It can tolerate a lack of nutrients or oxygen for a very short time, like 4 minutes.
Right.
So once it crosses the critical period, brain starts developing irreversible damage. So somebody has a cardiac arrest and the circulation is not restored, brain can go into a permanent damage. In spite of resuscitating him from the cardiac point of view, still the brain can be completely non-functional, which is like a brain death can happen.
So that's immediate death basically.
Yeah, it is, brain damage is irreversible.
Right.
So if it happens,
It's
and
fatal.
Yeah, it's not fatal that way. It is sometimes somebody can have a cardiac arrest and a prolonged cardiac arrest, and after some resuscitative efforts the heart may start working. So the heart is beating and heart is pumping normally, the heart's function is restored, but still during the time of cardiac arrest, the lack of blood supply to the brain has gone for complete loss of its function.
Right.
So that's the individual is brain dead but alive.
What kinds of care should they take after a cardiac arrest episode?
So cardiac arrest, when somebody has a cardiac arrest, immediately, as I said, resuscitative efforts are the best. You have to maintain the circulation to the brain by all means, which includes the CPR, what we call cardiopulmonary resuscitation, cardiac massage and breathing. Even if somebody is not giving a breathing, at least do the cardiac massage so that some blood goes into the brain.
Right.
And call for help, take him to the nearest hospital and address the primary cause for the cardiac arrest.
Okay. So what are the current advancements in medicine or specifically cardiology that did not that weren't there back when you started your journey in medicine?
A lot of things. So when I started my journey about 30 years ago to now, a lot of advancements, including change in the way we pharmacologically, a lot of changes.
Right.
We have a lot of new drugs which have come up, which treat heart failure. So this new research into heart failure, newer medications which prolong the survival in the individuals, and also newer drugs which are in the preventive role. They prevent heart disease, especially drugs which address the blood pressure, high cholesterol, diabetes. Newer medicines have come up. That is pharmacological. And in terms of interventional procedures, we have refined the interventional procedures, the way we address the angioplasty, newer things, what were hurdles earlier,
Right.
like the difficult to treat lesions or complex lesions. Thanks to newer technology, with the newer gadgets, we can tackle some of the lesions which we were not able to treat earlier. We are able to treat percutaneously, means by an angioplasty we are able to treat thanks to latest advancements.
Right.
Imaging, especially intravascular imaging, where we put a catheter inside the vessel and look at the vessel from inside. And
Okay.
not only this is a complementary test to the angiogram itself. And now we have newer diagnostic modalities coming up. CT is going a very at a rapid pace. We are now
Right.
able to pick up heart disease on CT coronary angiogram. We have an FFR, which is a fractional flow reserve, which has come integrated into CT coronary angio, which gives us an idea about blood vessel, the block, and what is to be done, the further plan. All this can be done by looking at these parameters. So we have advanced pharmacologically, we have advanced in diagnostics, we have advanced in the way we
treatments.
treat
Right.
complex lesions. So that's the last 1 or 2 decades we have a lot of advancements.
Right. How bad is caffeine to heart health?
See, in moderation it is not bad. It is, suppose somebody consumes too much of it, that
Right.
can lead to an increased heart rate, palpitations. It can make the heart irritable, produce what are known as ectopic beats, and which is sometimes distressing symptom, like somebody feeling their own heartbeat is like a distressing symptom, so it can produce that.
So are obese people more prone to heart diseases?
Obese people are more prone to heart disease by way of the risk factors. So obesity can lead to high blood pressure, it can lead to sleep disorders, it can make somebody prone to have diabetes, and it can alter the lipid parameters in a very bad manner, in the sense the good cholesterol levels come down and the bad cholesterol can go up. So by producing all this, it can lead to a heart disease.
Right. So let's do like a rapid fire now. So tea or coffee?
Coffee.
Okay. Early mornings or late nights?
Early mornings.
One habit everybody should adopt for their heart health today.
Exercise.
One health trend you'd like to see disappear.
Too much reliance on non-professional advice in the social media.
Most underrated health habit.
Exercise.
One thing patients should stop Googling.
The food hack or the magic diet which would cure the heart disease.
Best way to de-stress according to you.
Exercise and meditation.
Okay. Best sleep exercises.
Sleep exercises.
Like if somebody is struggling from
Sleep.
sleeplessness, insomnia,
Okay.
what should they do to improve sleep?
Sleep. So best way to improve sleep is avoiding all the unhealthy habits, like watching the
Smartphones,
phones and getting exposed to the artificial light,
Right.
especially after 8 or 9 in the night.
Okay. What did years of being a cardiologist teach you as a human? Or
So it's a very humbling experience, where we see lots of people, young, sometimes succumbing to heart disease, some of the old people surviving in spite of having very critical disease. So it's a very complex kind of exposure that we get, and it's a humbling experience. So it's not that doctors or cardiologists are lifesavers all the time.
So I'm sure handling really difficult diagnosis to the patient or their attenders must have been a very mentally draining thing. So how do you balance your mental health by being a doctor?
So many times I find that this is not a problem with most of us or the doctors. Why? Because we are passionate about our job. We love our job.
Right.
So we love to be there in that particular situation, because if we don't do it, nobody else would do it.
Right.
So because we love our job and we are passionate about it, we don't find it as mentally draining.
Okay.
As many people assume it is mentally draining. Yes, it's physically sometimes draining, but we know that we are doing our best. As long as we are doing our best and we are doing in the best interest of the patient, we are
Right.
helping.
True.
Sometimes we fail, we accept it, and that's how we carry on.
Right. So if you weren't a cardiologist today, which other career path would you have chosen?
Maybe a mechanical engineer.
Okay. So for all our viewers watching this episode of Beyond the Title, what's that one advice that you will force them to add into their routine today?
Exercise regularly, consistently, moderate exercise. You don't have to exercise too much.
Right.
Spend some time to de-stress. Maybe take up a hobby or some passion, pursue it, so that you come out of the stressful state from whatever work that you do,
Right.
and have a proper 6 to 7 hours of sleep, and get frequent health checkups. Look for risk factors like high blood pressure, diabetes, cholesterol, etc. And eating healthy, having de-stressed life, regular exercise. This is the way to keep your heart healthy and strong.
Okay. So thank you so much, sir, for coming down today. You have given us very valuable insights on cardiology and heart health. So thank you for your time.
Thank you.
Thank you.